Run It Studios and the Arthritis Foundation of Missouri bring you this special episode of the Run Radio Podcast. Welcome back to the Run Radio Podcast. Run It Studios partners with the Arthritis Foundation of Missouri to bring you some resources and information when it comes to running your health. When you have a chronic condition, things can just pile up on you. And the more equipped you are to have the resources and knowledge, the better you can handle it. And so I am excited to talk to Roy Whitley today. You are with RX Outreach. Welcome.
Welcome. Good morning, and thank you for the opportunity of letting RX Outreach have some time today to talk a little bit about what we do.
Yes, I am very excited to talk about what you do because I know when it comes to prescriptions and that's just a whole world on top of everything else you're dealing with. So tell me how you help the community and specifically chronic conditions, autoimmune disease, arthritis patients.
Absolutely. RX Outreach is the nation's only nationwide nonprofit mail order pharmacy. And so, what that really means is we are licensed in all 50 states and major US territories as well. And so, we really seek to reduce barriers to affordable medication, accessing affordable medication. And it looks like a lot of different things, right? So, we really kind of take out and reduce those barriers geographically, financially, and through social barriers as well. And we seek to cover all of the major chronic disease states to include arthritis. And so when you look at the RX Outreach website, you'll see that there are not just affordable options on the formulary as well, there will be free um, options as well.
So why does it get so complicated?
That's a great question. I think, you know, for a long time, healthcare has just kind of evolved over the years. And so for a long time, you would get a job, you have insurance, and you didn't really think about it beyond that. That was just kind of the way things went. You go to the pharmacy and you pay for your medication, you do what you need to do. As time has evolved, many things have happened. Medicaid expansion, closures of hospital systems. You go through COVID, the onset of telehealth, the onset of gig workers, high deductible plans, ACA plans with higher than usual deductibles as well. It's really just kind of moved people to have to navigate the healthcare system a little differently than what they've
Mhm.
been used to. And so RX Outreach recognized that way back in 2010 when we set to start up as this nonprofit that there were still individuals that, regardless of Medicaid and insurance through employers, there were still people kind of falling through the gaps, if you will. And
Mhm.
that's where we seek to really add some value because it's really about medication adherence and really improving health outcomes for not just our local community, but on a nationwide scale as well.
So what's the type of person that comes to you? This isn't for the person that is in the office setting that has their insurance, right? This is
It may be.
it could
That's a
be. Okay.
great question. So really, when you think about RX outreach, and kind of who you may be, right? You
Mhm.
could be in rural America, or even parts of urban America now where there are pharmacy deserts and there's no transportation opportunities to get to the pharmacy, or the pharmacy's an hour or two away. And so whether you have insurance or not, RX outreach is still here to help in those situations. You might be on insurance and have high deductibles
Uh-huh.
and not really going to maximize that deductible by the end of the year. RX Outreach is here to help in that regard as well. Most recently, where we see a lot of calls and questions are around Medicare patients because formularies change annually. And so we're seeing a lot of patients who were on a medication at one point and it was covered and now it's not, and it's a couple $100 at the counter. But then we also serve those that are uninsured or who may be on insurance and just the prescription plans, things have been carved off and the drug that they're looking to take isn't covered. So in a sense, we can help many people from all spectrums, whether you're insured or you're not. It really comes down to if the insurance that you have is working for you, we would
Mhm.
love for you to continue to use your local pharmacy and do that. But the moment that you're not going to go get the prescription filled,
Uh-huh.
or when you go get it filled, you're going to leave it at the counter due to price, or you're having to ration out that medication for any reason, we would like for you to call on RX Outreach and see if there's some things that we can do to help increase that medication adherence and get you healthy again.
Okay. Now, how would you be any different from, and I say this because you see the cards everywhere, Good RX and things like that, that are usually we're told, hey, check this out.
Sure. So how RX Outreach differs from like a Good RX? Good RX is a discount card, and so when you talk to individuals in the community, you often hear that that card's not accepted at every pharmacy. In some
Mm,
cases, people will have to go to 3 or 4 or 5 different pharmacies before the card is accepted. Um, some independents won't accept the cards. Even some retail locations we're learning from patients won't accept the cards either.
mm,
So with RX Outreach, it's fully transparent. So all of the price points and everything are on our website for one to check out. Because of how we secure product, both through donation and purchasing, the pricing really stays the same for long periods of time. It's not a daily
mm.
change. We have some sustainability to really keep prices as low as we possibly can by way of delivering to the patient's front doorstep as well. And so that's how we differ. What you see is what you
Okay.
get. We're not going to be for everybody. We truly are there to fill in those gaps where insurance is not working or
Okay.
healthcare systems. Think about FQHCs and hospital systems where 340B uh, doesn't work for a patient. That's really where RX Outreach stands out and really seeks to help.
So would you be prescription by prescription, or do people enroll for a certain duration?
It's prescription by prescription.
Okay.
So as a patient learns about RX outreach, and sometimes the clinicians in the doctor's offices and healthcare systems are referring RX outreach as well when they come across an individual who isn't being adherent to medication for whatever that reason might be. Most often, financials, especially in today's landscape. So it's prescription by prescription, and no enrollments at all for the RX Outreach Core program. Now, here locally in the St. Louis market and the St. Louis Metro, to include 2 counties in Illinois as well, we do have a Fill the Gap program.
Mm,
That program today it's a free medication program for 12 months with some educational services also wrapped around to help people understand the importance of medication adherence, healthy lifestyles, better eating habits. It's for ages 55 and up, suffering from diabetes, cardiovascular issues, and/or allergy issues. We're actively looking to expand that program as well, and so that's one of the things that we're most excited about with the Arthritis Foundation is, preliminary conversations early as how do we build a program that allows us to be able to do that for patients as well, suffering from arthritis.
good. Are there age parameters?
For the Fill the Gap program, yes, it's 55 and above. And I failed to mention 300% FPL, which is about $38,000 a year for an individual. That doesn't mean that when we launch this for the Arthritis Foundation, that that same parameter will be in place.
Uh-huh.
It's nimble enough that working kind of with the research that Arthritis Foundation has, what are the gaps? Who are the people that are still suffering from arthritis and the symptoms of arthritis that still are not able to get to the medication? We want to be able to help.
Yeah. But just RX outreach in general, if a child is not able to get their medicine, can you work with them, their parents, to make sure that the kids are getting their medicine? Or
Absolutely. No,
okay.
no age restrictions whatsoever on our formulary or on our program at all. We serve from infant to aging adults,
Yeah.
aging seniors. Also, RX Outreach is heavily generic based.
Okay.
We're working to add some brands here and there as we continue to have conversations with drug manufacturers around people falling in the gaps. And
Mhm.
so I say that to say if someone is looking for a product and they don't see it on the website, there is an option on the formulary list to be able to request us to look into adding the medication, and a patient can leave their information for us to contact them back via email or phone. And at the same time, if someone was calling into our contact center, our patient advocate specialist would be able to assist as well. And we have a mechanism from the phone call perspective too for people to be able to request us to look into adding medications. And so we do that. And to, put that in perspective, this year alone, we've added roughly 82 new
Oh.
drugs and drug strengths as a result of really the community reaching out and saying, "Hey, I'm struggling with this product or that product. Can you help?"
And how long has RX Outreach been around?
RX Outreach has been around as a nonprofit mail order pharmacy since 2010. We've served over 500,000 people since our inception, and continue to serve tens of thousands of patients annually.
That's great. Um, Now, as a nonprofit, you probably have needs. Are there things the community can do to help you?
Absolutely. So we constantly seek donations as a nonprofit because there are individuals who just simply don't have the financial means for various reasons to be able to afford their medication. And so that's really where that Fill the Gap program was born. We also partner with different free and charitable clinics all across America too, where we do some unique things there as well that funding would help us to continue to support those individuals who are also grant funded and just doing this work around health, improving health equity. But a unique thing, to consider is any patient really that uses the RX Outreach program that does not fall into the Fill the Gap program or the Community Partner Network, in a sense, is really helping by providing dollars to support and subsidize those two programs as well. So it's a unique opportunity that allows individuals to be philanthropic without necessarily having to write a check for just a blank donation, right? But all of those things are truly helpful and helps us to continue the work that we're doing. And as I think about some of the recent legislation changes at the federal level, it's more important now, I think, than ever that we really get that word out there so folks understand that as things change and you navigate that system, RX Outreach is here to help. But yes, if donations, no amount's too small, every dollar certainly helps to ensure someone is getting medication that they truly need.
That's great. Thank you. Anything else I haven't thought to ask?
I think, as I think about RX Outreach and, where we're kind of headed, where we're kind of going, you know, I would like to just kind of put out there too that RX Outreach does have a staff of pharmacists. And so if at any point patients have questions about medications that they may be taking, that may be being prescribed, we really want to educate patients, right? Because sometimes individuals end up seeing a specialist and a regular doctor and maybe a third specialist. And when that happens, everybody's prescribing different medications. And so sometimes, the medications can cause different interactions and things like that. And so rather than someone stopping the medication altogether, we would love to have a conversation with them and just kind of do that review with them as well. We offer services like that as well. And I would say, for any listener who's a clinician or that works in a healthcare setting, definitely reach out to RX Outreach about our community health, community partner network. I'm sorry. Because we really want to have those conversations and really educate those individuals as well. Because you mentioned it earlier, a lot of times folks are given a good RX card or other discount cards, and
Mhm.
those are great and when they work, but when they don't work, we want folks to know that RX Outreach is here. Ultimately, if a patient is not going to take the medication they've been prescribed, we want to talk to them because we understand and know that there's some sort of barrier that might be preventing that individual from doing that.
Very good. Well, thank you so much. You're doing very important work, and I'm glad you're partnering with the Arthritis Foundation to make sure that people get the medicine that they need to live a better life. Thank you so much.
Yep, I think I would add to just RX Outreach's website,
Yes.
www.rxoutreach.org, or feel free to give us a call at 314-222-0472. Our patient advocates are out there on the phones all day, every day, ready to serve.
Thank you so much, Roy. Perfect.
Thank you.
All right. Thank you so much. You can find out more and watch videos when you link over to watch or listen from any platform from runitstudios.com.